So within WHO, there's been a lot of efforts to support the data collection, visualization, interpretation, as well as dissemination. And today I'm just going to choose 3 tools to present to you. That's the Micronutrients database, the Micronutrient Survey Manual, and if we have time, then I'll go through the WHO Global Database on the implementation of food and nutrition action because it was just updated. So hopefully we'll have time for that. But within these tools, they fall into what we call the whole data journey or the data pathway. And this results to some of the guidance that is provided about the assessment of either hemoglobin or some of the different micronutrients. Then we go into survey planning and data collection. We go into the analysis of data, which you're going to hear from my colleagues tomorrow about the Micronutrient Survey Analyzer. We go into information about reporting on some of these results, as well as how do we store some of the data out there for additional use at a later stage. So first, I just want to ask you, with a raise of hands, who is familiar with the Micronutrient Survey Manual? Who has ever accessed it? Okay, well, there's a good number. I mean, many of them I know, but I think this is something that was first published in 2007, and then it was updated in 2020 by a group of partners. So not just WHO, but UNICEF, Nutrition International, and CDC. And what we have aimed with this is to really support those who are conducting cross-sectional surveys that involve the analysis of micronutrient biomarkers. It is an interactive tool, so it's a printed manual, but it also has an interactive website that we call an ebook. It has 17 different modules. It has lots of different tools and toolkits or tools that are provided to help implement some of the recommendations within the manual. And you can search for these tools. So if you know specifically some area of work that you need to focus on, then you can search for these different tools. So online, it's very interactive and useful, but if you need it for offline purposes, you can also use it as an offline platform. You can download it and take it with you wherever you need to go as well. So what I wanted to do is just hit on some of the highlights. Now, if I could spend hours here today walking through every portion of the survey manual, but I'm just going to do some highlights from this manual as well. So what you would like to do is I wanted to point to that recent update. So if you used the manual in the past and you want to come to it newly and want to know what's been updated, that's going to be on the very front page. So all the recent updates will be right there. If you see that green box in the middle, Explore Content, that's going to take you to the table of contents there. So that's where we see the 17 modules. You cannot see them here, but I show you there are 17 modules. They really run through how do you plan and design your survey? What are some of the indicators that you might want to select and how would you select them? How would you think about their analysis, think about the lab, think about sample size, thinking about if you're doing a cluster survey. And then it takes you all the way to the end of how do you prepare a survey report and how do you disseminate some of those findings. So if you click on one of those modules and you want to know more about that module, that's going to pop up on the bottom of the screen there. So that's going to tell you what's within that module, and it's going to tell you the target population for that, like who is the user and what kind of user would find this module the most informative. And then you would click on that green button there and you can view the entire module. So when you do that, what's going to happen is that you're going to be able to come to different subsections with the module. So if you're interested in selecting your biomarkers, you know that you're going to select an iron biomarker, you can go directly to iron deficiency, and that's going to take you to that section directly, so you don't have to scroll down through everything. And also, you'll see on the right-hand side, within the module, you're going to have links, different hyperlinks to different tools that are very applicable to that section that you're reading. And you can click on it, and that's going to show you on that right-hand pathway so that you'll be able to easily find the different resources that are applicable to the content that you're reading. So that's the resources there. And then if you wanted to print that module, what you do is you go right up here to the right or upper left-hand side, and you can print that module, take it with you for whatever purposes you might need. And then particularly when we're looking within the module, for Module 3 on biomarker selection, you will find a lot of good information on the best practices. Now, we heard about some of the best practices this morning. All that information is incorporated into the Micronutrient Survey Manual and all the tools that are linked there. But they do include best practices for things like the specimen collection, biomarker analysis, thinking about what kind of budget you might need for this analysis, and how do you interpret those results as well. Another great feature about this toolkit is that there are links to a number of different data collection tools and manuals that you can use within your own field work. So this would include everything from sample-informed consent forms, different calculators for determining age, thinking about lab specimen log forms. So you don't have to reinvent these new tools or things. You can use those, you can modify them to your needs, and we found that this is something that's really helpful to the end users as well. We also have a section on data processing and analysis, including those thinking about designs with stratification and clustering, and we also have information about the interpretation of those nutrition indicators. So last, I'll just mention that the module reports on, or mentioned this last module, 16, thinks about survey reports and dissemination of those findings, provides examples of different types of presentations, giving tips of what kind of information is helpful to present and how to present it visually. So this is also something that we find really helpful, particularly when you're thinking about maybe sharing some of that data for some global platforms. And one of those global platforms that I wanted to mention is the WHO Micronutrients database. So this has been something that WHO has maintained since the 1990s, and there's some people on the stage that were involved in those early developments of it. And we've been working with this database as it was called for its development through some of the World Health Assembly resolutions that said we really need to track what is happening with regard to the micronutrient status of populations globally. And we started this database with indicators for iron, vitamin A, iron meaning anemia, but vitamin A and iodine. So it was a very useful and very simple database that was used for many years to report on the global status. But what we've tried to do is really expand this database, and today it has over 40 different biomarkers for different micronutrients. So we have everything from the big five that Jonathan mentioned this morning to indicators for riboflavin, vitamin C, B6, folate, B12. We have all the different biomarkers that you countries are reporting on, and we put them into the database in this expansion. So we're also trying to really provide information on the way that these samples were collected, the way that the specimen, whether it's a plasma specimen, whether it's a dry blood spot, whole blood, red blood cells, urine, if it's capillary blood, if it's venous blood, urine collection, how the data may have been adjusted. So if you used adjustments for elevation, smoking, inflammation, and what methods for adjustment were used as well. We're trying to collect information on whether those samples were fasting, what kind of analytical measure and method was used, the name of the laboratory, and any reported internal and external quality assurance procedures that were made. And this just helps provide a little bit more information about how that data was collected and how we might be able to interpret it for use in a broader perspective. So here we're just illustrating the data flow. So a lot of their data comes from partners, from countries like yourselves, other UN agencies, and we periodically do a systematic search for data as well. We have specific inclusion criteria, making sure that the data is representative, sure that it's a household or facility-based. We're thinking about what kind of validation has gone into some of that data collection techniques. We look at some quality checks as data implausibility, looking at completeness of reporting as well. We have a double check, so we have one person that enters all the information, then we have a second person who does all that verification. We, once the survey methodology is complete, then we provide that information to the published output platforms. Right now we have 2 different output platforms that we're using. Technology is always changing and the capabilities of each of them are changing, so we decided to keep 2 different platforms, 1 for entry and then 2 for showing the data as well. So one of those platforms is called the Nutrition Data Portal. It was developed in 2021. This is an interactive portal that contains 3 different nutrition databases, including the Micronutrients database, but also the Child Growth database, as well as the Nutrition Landscape Information System. The QR code will take you there, but I think you guys are probably over QR codes now, and you can see this in your when you get the presentations. So this is sort of what it looks like. I'll walk you through it since it's very hard to read, but this is the interface when you come to the Micronutrients database. There are many options for viewing the data. You can search by micronutrient, you can search by population group, you can download data by telling what micronutrient you're interested in, what indicator, what country, or what countries. It doesn't have to be just one. You can also see this box down here. It's called a country profile. If you click on that, you'll get a list of countries, and then you can have a little output of all the different data that's available for a specific country. If you want information on a specific indicator, you can go to the indicator list and you can click on that and it'll tell you more about the different micronutrient indicators. The button on the right top will take you to the other platform within the Vitamin Mineral Information System. We have information about us and about how we're collecting the data, different links, and then you have access to the Global Health Observatory, which has the data on hemoglobin as well as many other indicators that would be contributory to anemia as well. That would be very interesting. So here, I just want to give you an example of what would happen if you searched by population group and present to some of the different filters that are available. So not only can you select your population group of interest, but you can select the anemia or condition or any other micronutrient that you'd be interested in, the indicator, the countries or the regions, and if you'd like data presented by urban or rural area or by different sex. So if you did that, then you will have information that's presented in a graphical format, and you have different choices of how you would view that graph. So here we're graphing pregnant women, hemoglobin for many different countries within the region, and you see this graph that shows the prevalence on the x-axis and the different color bars represent different countries. Okay, thank you. And then you can look at the data in different ways by switching on the graphical toggle. You can see what the underlying data is that presents in the graph, and then you can also look at some of the metadata, looking at some of the references and more information about that data in the bottom graph. All this information can be exported. You can either export the data or you can export it as a report as well for use as you need. When I mentioned the country profile, so here's what you would get. You would get here's for Kenya, what you would see are 6 different graphs. We have them as default graphs, but you're able to choose and customize the graphs any way you want for whatever indicators you might be interested in and population groups as well. We just standardize it to some of the more common indicators and population groups that are monitored, but you can really customize it yourself for your own needs. So here's what it would look like. As I mentioned, we have 6 different graphs. That all gets printed on one page. And then in the following pages, you have more information about each graph. So if you wanted to present this to others, you would have all the information that goes behind that as well. So what is different about the data portal and the display in the micronutrients database within the vitamin mineral information system? There's one important feature. One is that what's in the nutrition data portal is all national level data. What's in the VMNIS goes down to first administrative level data. So you can get much more granularity of that information, and you can also map the data as well. So we find that useful for different purposes as well. So you have the same sort of series of filters where you can choose your nutrient of interest. You see all the data that is available for that nutrient. You can choose your population group, what representativeness, so if you want local or if you want the first admin level, regional or national. You can choose the date range and the region or the country as well, so it's very customizable. And then we just have the graphs as well. So you have similar features to where you can choose your population group, date range, what kind of region, and then you have the map here that's sort of a heat map with the darker color, meaning the higher the prevalence of that deficiency. This is iron deficiency anemia in preschool age children that's being mapped here as well. So I'll just introduce this. I'm not going to go through all the slides for the global database on the implementation of nutrition, food nutrition action due to time, but this will be just an introduction for you to let you know that there is an interactive platform for sharing information about different policies and actions that are related to nutrition. We really wanted to be able to provide greater access to some of the data, to be able to assess, monitor, and share some of the lessons learned to improve policies, particularly those that support healthy diets and that are really supporting the reduction of the burden of diet-related diseases. So just to tell you some of the features here is that you can map the nutrition policies and actions. You can link the policies and actions to nutrition status indicators as well, monitor implementation of key nutrition actions, looking at some of the overlaps and gaps, and then to also share experiences on implementation practices. So I do encourage you who are all interested in looking at some of the policies and actions related to not only anemia and nutrition, but to some of the food policies as well, because this is how it has been recently updated. We used to call it GINA, now it's GIFNA, so we've added the food policies as well. So hopefully that will be helpful to you. Again, we'll work with Dina to make sure that we have all these different tools and their strengths and weaknesses there for you. Thank you very much.